Does your brain actually feel like chaos? Do you want to learn how to rewire your anxious brain? Have you heard of neuroplasticity? And you're like, oh, I want to change my brain. Neuroplasticity is the ability for your brain to change. But I think you need to understand anxiety a little more. We often talk about anxiety skills. What do we do? We're anxious. Take deep breaths or, go for a walk or do things specifically to decrease your anxiety. And those things are absolutely great, but they are not going to completely rewire your brain. You need to have a better understanding of what anxiety is and where it comes from. My name's Christy Bundukumara. I am a psychiatric nurse practitioner. I have been practicing psychiatry for over 20 years, but my real experience comes from my life. So I have had lots of grief and trauma. In 2005, I lost my son in a drowning accident. I had 5 adopted children, 2 biological, and working full time and just having to go on with life. That next year, my son was diagnosed with catastrophic epilepsy. His seizures would not stop. Later diagnosed with a rare neurodegenerative condition that they tested my whole family, and my other biological child and my husband had this rare DRPLA. So you want to talk about fear and anxiety and trauma. I have experienced it. And so I stand here from experience, both professionally and personally. In 2016, I lost my son Reggie with that catastrophic epilepsy. Then I lost my daughter Maya. And most recently, my husband Bundy passed away from this rare neurodegenerative condition. If you are experiencing intense grief, I want you to click on the link below so that you can learn about my grief intensive and how I guide people through healing from traumatic grief. But today we're going to talk about anxiety and how do we rewire our brain and how do we take advantage of the ability for neuroplasticity and what skills do we need to do that. So when I think of anxiety, one, I think of fear, right? There's something that we're afraid of. And oftentimes I will be talking to a patient and they will say to me, I don't know what I'm afraid of. The anxiety just comes over me. And that often happens if you have no idea what you're anxious about and where that anxiety is coming from, you really need to learn the Mentally Strong method. And I do teach it in the grief intensive, and I teach it online and other avenues. But we need to understand what is under anxiety. Anxiety can be a normal emotion, but when it comes up, it's severe. It stops you from being productive. Either you get paralyzed or you are so anxious you are having a panic attack. You can't function through those things. And oftentimes people will come to me as a psychiatric nurse practitioner and they'll, I want something for my anxiety. I want a medicine for my anxiety. And there are medicines for anxiety. I can tell you the number one treatment for anxiety is an antidepressant called SSRI, selective serotonin reuptake inhibitor. And I understand you're like, but it's not depression, it's anxiety. However, the anxiety is often worsened by this imbalance in the neurotransmitters. This increases serotonin and some other neurotransmitters to allow more communication between the cells and help you decrease your anxiety. There are medications that are specific that stop anxiety. Maybe you've gone to the emergency room in a panic attack. You think you're having a heart attack. They say it's a panic attack. They give you a medication. It goes away and you want that medication. I challenge you that you do not want that medication. That medication is just putting a Band-Aid on the anxiety and not actually getting to the root cause. So the first thing to understand about rewiring your brain to manage this anxiety is knowing where it comes from. So when I talk about the Mentally Strong method, I talk about think, organize, choose. And we want to be able to think through our problems. We need to be able to organize them so that we can make choices in line with what we want. So when I say organize, I mean putting things into different categories because we do different things about it. So maybe you've experienced some intense grief or trauma. Those go in their own category because healing for grief and trauma are very different. Healing for grief is about feeling the pain and cherishing the relationship. But if it's enmeshed with your trauma, like it was in losing my children, you have to separate that because the goal in trauma is to process and release that pain, right? But the pain of grief, it is okay to hold it close and cherish it. It is yours. You might also have spiritual conflict. You might have negative dialogue going on in your head that needs to be addressed. So what is under that anxiety is super important, and you may not be able to figure out in this one video. But I want to explain anxiety to you. Anxiety is good. It is what allows us to be productive and motivated. And I want you to think of your anxiety as a continuum. And we're going to draw a line here and, starting from 0 to 10. 0 means no anxiety at all. 10 means I'm going to the emergency room. I feel like I'm having a heart attack, right? That's the scale of anxiety. Mild anxiety, 1 to 3, is actually super productive. So let's talk about that. Let's say you are about to study for a test, or you have a performance coming up, or you have a presentation at work, you have to present something to your boss. Mild anxiety will allow you to focus and be prepared to be good at what you want to be good at. Now, what often happens is there's moderate anxiety. And moderate anxiety, you can push through it, you can use some skills, maybe get those things down. And maybe it is horrible for you to have to do a presentation, but you get through it. But you are exhausted afterwards because it caused moderate anxiety. And I would rate moderate anxiety from like a 4 to a 7 on that. Remember that scale, 0 to 10. Things that are 8 and above are not productive at all. They are very dysfunctional. So if you have severe anxiety, if you get stomach ulcers or you get migraines and you know that it's from your stress, this is severe anxiety and it's impacting you physically and it is impacting your ability to be productive. So let's look at that anxiety on a scale. Now, if you're watching this video, you probably struggle with moderate to severe anxiety or you wouldn't still be watching, right? And you're like, yeah, but this is what I struggle with. This is who I am. I'm just an anxious person. And I get that. And that can be true. This could be your struggle, the thing that you need to learn to work through, right? Learn to rewire your brain so that you have control of anxiety. And I have been told by some of my patients, don't use the word control. Control is a trigger for me. And maybe that's because someone else had control of them. Maybe it's because they feel like they don't have control. But you do have control of your anxiety. But what often happens is people want you to go from a 10 to a 0. They'll say, don't be anxious, don't be anxious, don't be anxious. How many times have you heard, don't be anxious? If I were to say to you right now, whatever you do not think of an elephant. What happens? Do you think of an elephant? When someone says, or when you tell yourself, do not be anxious, you're likely putting fuel on the fire. You're likely making yourself more anxious. So what do? Go back to this continuum. Where are you right now? Okay, maybe you're watching this, maybe it's, fairly low, 5, 6, but you know that when you're real anxious, you're at a 7 or 8. Instead of telling yourself, do not be anxious, I want you to think about how can I take that down 1 or 2 notches? So if you are right now sitting there at a 6, can you bring it down to a 4? Can you feed the part of you that is not afraid? Because when we think of anxiety as an all or nothing, it's overwhelming and all you can do is think negatively and say, I can't. Because anxiety is normal. It is your body's response to life. And if you are like me, have had multiple things happen, you have a reason to be anxious. But if you are in that severe, you've got to bring it down to moderate. In moderate, we can function. It's exhausting. It's truly exhausting, but in moderate, you can function. And if you can learn to function in moderate, and we can slowly over time bring that down to sometimes none, sometimes mild. But even if you consider yourself an anxious person, there are anxious personality types, okay? Remember, I am all about knowing who you are and improving yourself in a very authentic way. So let's say you're like, yeah, but I'm just an anxious person. I've been anxious since I was a child. I think we should map that, and that's with something that we do in the Mentally Strong Method is we map out feelings and we ask ourselves when the first time we felt like that, and we bring up these patterns that started in childhood. So it's likely from trauma or even micro trauma or negative thoughts early in childhood that are still contributing to your anxiety today. So again, remember I talked about in the beginning, like understanding where it's coming from is important. So when we do a thought map, we kind of get down into the nitty-gritty of where does that thought originally come from, because it helps us to rewire it, right? That's the point of watching this video. We're going to rewire it and take advantage of that neuroplasticity. But we have to have those anxiety skills, anti-anxiety skills. Oftentimes, I will have patients come into me and they'll be like, oh, I tried the deep breathing, it doesn't work. Again, it's probably because you're trying to go from 10 to 0 and you're telling yourself not to be anxious. And so then you're going to be anxious. All I need you to do is take those deep breaths, find things that decrease your anxiety by 1 or 2 points, and consistently do those so that you can be in a mild to moderate anxiety, which is normal, right? If you think about life and how our body is made, anxiety is normal. Severe anxiety is not okay. It's not healthy. It's a biological normal response in your body, but it is not healthy. And you do have some control over it, but not to the extent of turning it on and off. It has to be in this continuum of slowly decreasing the anxiety so that you can have control of it, that you can be in mild anxiety when you need to do a presentation. And then maybe if you're in real danger or someone you love is in real danger, it goes up to moderate. That's what moderate anxiety is for, to be able to function in a real emergency. But if you go to severe, you're not functioning and you're not able to respond in real emergencies. And you're probably causing some physical symptoms based on this chronic anxiety, which is causing chronic chemical reactions in your body of cortisol and inflammation and kind of this cycle that happens with chronic high levels of anxiety. So learning to rewire your brain, one, you're going to figure out what's underneath that, where it's all coming from, and learning the Mentally Strong Method is a great way to do that. Then you're going to always remind yourself that it is a continuum and that it needs to just come down a couple notches. Stay out of that severe. If you find yourself in the severe, you're just trying to get to moderate. You're not trying to stop your anxiety. But as you learn skills that decrease your anxiety, it gives you more confidence in that control. Remember I said in the beginning, I've been told by patients that the word control is a trigger. They don't have control of their anxiety. But just think, if you could practice decreasing your anxiety by 2 notches every time you feel it coming up, that would build confidence in yourself to be able to, confidently say, I can control my anxiety. Okay? If you struggle with severe anxiety on a regular basis, please, get involved with a provider to kind of help medically get you into a safer space. We can, talk about medications later, but sometimes we do need to use medications to get to some of those confidence factors of being able to control the anxiety. So I've got a couple questions here. The first question is, tells her story is, I, like you, have lost a child. I am afraid and severely anxious of losing another child. That's a lot of grief and trauma. Losing a child is traumatic, and that is very heavy grief, right? So when I talk about grief and trauma, like feeling the pain of grief and holding it tightly and cherishing that relationship is part of the healing process. But what often happens is that the grief is traumatic and they're holding on to the trauma, which is going to cause anxiety for sure. So first, learning to separate the grief and the trauma, and working through the trauma so that you can release it and you can hold on to the grief without holding on to the trauma. And we teach that in the Grief Intensive. Click the link below to learn more. But also going back to this anxiety continuum. I've lost more than one child. And I honestly thought, God, okay, God, I've lost one. You wouldn't allow this to happen again. And then I lost another, and then another, right? So could it happen again? Yes. And that's where mild anxiety comes in. If you look at that continuum, it is perfectly normal and safe for you to have mild anxiety about losing another child. And if they are in danger, let's say they're going to a friend's house to a pool party, and then you have moderate anxiety around that pool party, that's actually good. So you would have a conversation with them before going to the pool party. You would be more diligent sitting at the edge of the pool watching them swim. You would probably choose not to let them go to a pool party by themselves, right? Moderate anxiety can be protective. And so it is perfectly normal and improves safety for you to have mild anxiety around losing another child. But when it is severe and constant, you are literally killing yourself from the inside, right? That stress is not sustainable long term. Your body will begin to break down. So back to what I talk about of bringing those things, that anxiety down to a manageable level, having mild anxiety about losing another child is safe. And I want you to be safe. But the constant moderate and the severe is not. And so it's about that continuum, right? And how can you feed the part of you that does believe that it's going to be okay, right? And, living in the moment. But it's okay to be afraid when there is danger. But when you are sitting home with your child safely in your house and you're having family dinner and you're anxious, that is a waste of energy. That is not what anxiety is for. That is when I want you to use skills to decrease your anxiety to at least a mild level. Very, very good question. Next question. I have anxiety about my financial situation. I constantly think of the verse, do not be anxious about anything. Give your requests to God and just pray. And I've been praying for financial resources and things like that. That is great. That is great for your spiritual health. It is great for manifestation. We know that the more you believe that positive things will happen, the more likely it is, right? But you have a lot of anxiety around it. So there's part of you that doesn't believe. But I also want you to look at behaviors and choices, right? Oftentimes we are anxious about something happening and we're doing things that could contribute to it. For example, we just got through the holiday season, and I know people, talk about finances in the holidays, and then I see them giving gifts that they probably shouldn't be giving based on their financial situation, right? And so are there behaviors and choices? Are there things that you are doing? And I don't know if this is true, but it is the first thing I think about in financial situations. that are contributing, whether it be spending or a lack of working. Sometimes, I hear, well, I can't work outside the home. I have this or that. But you could maybe ask your neighbor to shovel their driveway for some money. You could, there's little ways that you could potentially make some money. And so I want you to go back to the anxiety continuum, right? Couple notches. If you had an extra $200 a month, that's $50 a week, would that improve your financial situation? Is there something you could do for $50 a week, right? Is there, and put that on the reverse. Is there a place that you could cut $50 a week? Okay. In that continuum of anxiety, the mild, moderate, severe, again, mild anxiety would have been helpful. If you have financial problems, having some anxiety to figure it out, to solve that problem is important. When it gets to moderate and severe and it decreases your productivity and problem-solving ability, it's just contributing to the problem, right? So what can you do to bring that down to mild so that you can make some decisions that will improve your financial situation? Using the whole mentally strong method, continuing to pray, believing that other resources will come is super important, but behaviors and choices are also important. Next question. I have been in therapy on and off my whole life. I know lots of anxiety skills. They seem to work, but not forever. I have chronic, moderate to severe anxiety, and I am exhausted. This goes back to what I said, number one. Anxiety skills are great to bring things a couple notches down in the continuum, right? But if you don't know where that anxiety is coming from, then it's going to be a constant struggle your whole life, right? So you have to figure out the why and use skills to come down. Now, if you've been in therapy and you've discussed the whys and you've tried to work through some of those things, you just are not able to, that's when I say consider medication, right? Consider other modalities that actually help the biochemical part of what's going on here, because we know that there are some biochemical components to anxiety going on in your brain. So taking care of yourself is being honest with yourself. Have you identified what's underneath that anxiety, where it's coming from? Have you attempted to work through those things yourself or with a therapist? And if so, have you considered medication or other modalities that actually begin to change the wiring in the brain, right? We know that, back to the title, right? Rewiring your brain, that anxious brain is complex. And there are medications that decrease inflammation and help with the rewiring. Positive self-talk helps with the rewiring. But if you are trying your hardest and not successful, please seek professional intervention. Oh, this last question is from a fellow grieving mother who lost her child. And she says that I feel like people are pushing me to heal faster than I'm ready, and that is causing me anxiety. So this has to do with, we say boundaries. I like to say limits. Like, what is your capacity to do things? Because sometimes when we think of boundaries, if I say, I am not going to do this, but then I kind of want to do it a couple months later, then I feel like I'm like second guessing my own boundaries. If I say this is a limit, I can't do this right now, but then in a couple months you ask again, and I'm like, okay, maybe I'm ready, right? And so limits are kind of like soft boundaries. And I want to challenge you to kind of create those soft boundaries. What do you need to take care of yourself today, this week, this month? And ask yourself that over and over again as you learn to rewire your brain. But when you've lost a child, and I know this person, it was this year, you need to give yourself more grace and love than you ever thought possible. And, trying to think of boundaries and limits and things like that, I want you to think of them very softly and gently. I want you to be gentle with yourself. Oftentimes, anxiety is when we're not gentle with ourselves, when we are expecting more from ourselves than possible in a healthy way. These were great questions. I want you to continue watching 6 traits of people who struggle. This often is people who struggle with anxiety will, have these traits. And how do we rewire that brain? I believe that you are mentally strong.